we need to relook at some ethical and legal principles as it relates to gerontology. So we're going to look at some of the concepts. We really need to look at our own personal values, attitudes, and expectations about aging on the care of the older adults and their families. We do have to look at that medical legal factors when we're making decisions with the care of the geriatric patient. And we really have to look at autonomy and supporting self-determination decisions. There's a lot of terms here in relation to legal and ethical principles that will be discussed throughout the readings. This can be very challenging. We have to keep their autonomy as much as possible, even as their cognition and capabilities, capacity to make decisions changes. We need to look at being that advocate for the patient. Maintaining their confidentiality, this can be so hard with family. They may not want family to know, and they do have a right. The focus is on the quality of life, which may not always be the quantity or the timeline of life, the sanctity of life itself. So we really have to go back to those ethical and moral principles that guide us and help with them. Remember, whenever we have an ethical conflict, it's really a choice between two equal possibilities and becomes that right or wrong. It's what is best. Moral distress is when a person wants to do the right thing but is limited. What do we mean by that? We're talking again about end-of-life choices and decisions. And my mother, I had power of attorney for health care. My mom was declared incompetent. So I was activated. And I had promised her I would assist her with her suicide when the time came. The problem came, I was in a state where it was not legal. I didn't have appropriate medications available. And so for 3 days, I had to watch and not fulfill a promise. And it caused me a lot of moral distress. Personally, I had promised that to my mom. It's what she wanted. I wanted to do the right thing by her, but I couldn't. It becomes a very personal choice. Moral uncertainty occurs when you have confusion in situations when the person is kind of uncertain about what problem or which moral principles or values does the situation apply to. We're left with that moral dilemma when two or more principles apply that really mutually will support different actions. And moral sensitivity, stress, and burnout really can happen when you look at the ethics of caring. So with these, we do have a professional code of ethics, and that became very difficult for me since I am a nurse and I have a code of ethics. But at that moment, I was not my mother's nurse. I was her daughter. But when working with clients, we have to be able to follow that code of ethics that is right for all our clients, and it's what they deserve. First and foremost, under the scope and standards of nursing practice, advocacy is a fundamental aspect, especially related to ethical considerations and legal considerations. Autonomy means that that person has a right to make their own independent choices. And we need to respect that. People give up treatments, stop taking their pills, and they can have their tube feeding taken out. But as long as they're making informed decisions, that's okay. Benefits and malfeasance is about the concept of good and to do no harm. We want to always do on the benefit of what is good, and we never intentionally mean to cause harm. We always have to maintain confidentiality no matter where we work. Fidelity means that we keep our promises to one another, and in that case I gave you about my mom, I didn't keep my agreement or my commitment that I had promised her. But we have to keep our promises to our patients. And I don't mean in assisted suicide, but fidelity means if I say I'm going to be there for you, I need to be there. And if I'm not, I'm breaking that moral principle. Fiduciary responsibility is about the finances. Somebody, they may need help, and our role is to make sure that that person is not being taken advantage of, um, which is hard to see sometimes when you're working in home care, um, children taking parents' money. Justice is just what it means, that we need to be fair, just and fair. We can't have biases, especially age-related bias. When things are restricted or taken away, that really can burden the family. Big terms that come up with are the quality of life, but your personal perception is really what is most important. That quality of life is what that person believes that it is. Sanctity of life is the value you place on it. Reciprocity is a little bit about integrity. You need to be true to yourself while you support somebody else. And that's why in a lot of these assignments, you're doing a lot of self-reflecting. Because you have to own yourself to be able to be true to someone else. Veracity is telling the truth. I will tell you that you have a terminal illness. I will give you all the information. But people have a right to know, and that's veracity. Informed consent. People have a right, as we're saying, to make their own decisions. But it is our job to talk about those pros and cons. What would happen if no action was taken? What would happen if you quit taking your medication? And again, people have a right to choose, even when we don't agree with it. But this is where patient rights come into the biggest deal, and why, again, in a couple chapters, we are talking about advanced directives and living wills. The person, as long as they're of sound mind, always has a right to change their mind, say what they want to do, but the advanced directive needs to be activated when someone can no longer speak for themselves. And this becomes the legal issues with pulling the plug, or looking at a lot of the cases that have been put before us where the power of attorney has decided that it's time to stop, but maybe not all the family agrees, but that power of attorney still has the right to do that, but it should be based upon what that person wanted. Again, durable power of attorney, that right to make legal decisions, both financially and medically. A person needs to be declared competent to make decisions, and this becomes an issue, especially with the dementias or lack of oxygen with some diseases, is that when people are making decisions, it's our job to work with providers to make sure that they're making competent decisions. Not only informed, but competent. It is a violation of the code of ethics to assist with suicide. Now, true assisted suicide is where the person takes the medication themselves. They're not in the Kevorkian van. In 1997, Oregon was the first state that allowed assisted suicide or euthanasia. I did put a web link out there as of 2014, 3 states have legalized assisted suicide. Montana is a 4th state where it's in legislation and probably going to pass through. All the other states, it is illegal. So it's a very fine line. However, when you're working culturally, you have to remember that in some cultures this is okay. In many countries, physician-assisted suicide in England is very the normal. Sweden, a lot of our European countries. So as we have some of these foreign born here, we have to keep that in mind. We do know that medical errors, and I think this just astounds me, that the average patient can expect to be subjected to 1 medication error per day is horrific. We should have enough checks and balances in place and checking our rights of medication 3 times, as we've learned. Another thing that comes into play with the elderly is a conflict of interest. We should be doing nothing where there's a gain in opportunity for us. We are not part of that person's life. We are there as a caregiver, as a healthcare provider. We can emotionally get attached to some of these people, but that's a fine line you need to draw the sand in. So this was just a review of the ethical and legal principles, that we do follow it under our scope and standards of practice by the American Nurses Association, that it is a violation of the Code of Ethics to assist in suicide. I believe this will change in the future. And we always need to follow a true framework when making ethical decisions.